CEN Emergency Nursing Exam Prep. Question 1. A previously healthy patient presents with acute onset of shortness of breath, hypoxia, and normal chest X-ray. The nurse's primary differential diagnosis is pulmonary embolism, asthma, pneumothorax, myocardial infarction. Question 2. A patient with type 1 diabetes presents with vomiting, abdominal pain, and a serum glucose of 650 milligrams per deciliter. The nurse anticipates the following laboratory finding: respiratory alkalosis, metabolic alkalosis, metabolic acidosis, normal anion gap. Question 3. A patient with acute psychosis is becoming increasingly agitated and making verbal threats. The nurse's priority is administering antipsychotics, one-to-one observation, placing the patient in a seclusion room, contacting security. Question 4. A patient with a history of sickle cell disease presents with severe back and chest pain. The nurse suspects musculoskeletal strain, vaso-occlusive crisis, pulmonary embolism, myocardial infarction. Question 5. A 28-year-old female presents with lower abdominal pain and vaginal bleeding. She is 8 weeks pregnant. The nurse suspects appendicitis, ectopic pregnancy, pelvic inflammatory disease, ovarian cyst rupture. Question 6. During a cardiac arrest, the first dose of epinephrine should be given immediately after the first defibrillation attempt, after 2 minutes of CPR, before any defibrillation attempts, only after obtaining an advanced airway. Question 7. A patient presents with urticaria, angioedema, and difficulty breathing after receiving 4 contrast dye. The nurse's priority is to administer diphenhydramine, administer epinephrine, start in 4, call a code. Question 8. Following blunt chest trauma, a patient has absent breath sounds on the left, tracheal deviation to the right, and hypotension. The nurse suspects massive hemothorax, tension pneumothorax, simple pneumothorax, cardiac tamponade. Question 9. A patient in the ED is in ventricular tachycardia without a pulse. The nurse's priority intervention is administer a miodaron 300 milligrams for push. Perform immediate defibrillation with 120 to 200 J biphasic. Start chest compressions. Establish an advanced airway. Question 10. A patient presents with a painful, swollen, and red leg after a minor injury. The nurse notes warmth and tenderness along the vein. This is most consistent with deep vein thrombosis, superficial thrombophlebitis, cellulitis, muscle strain. Question 11. A patient with a terminal illness requests a do not resuscitate order. The nurse's role is to encourage the patient to discuss this with their family, notify the physician, and support the patient's decision. Refuse to care for the patient. Contact the hospital ethics committee. Question 12. A patient involved in a high-speed motor vehicle collision presents with hypotension, abdominal distension, and a positive FAST exam. The nurse anticipates emergent CT scan, immediate laparotomy, observation in the ED, administration of vasopressors. Question 13. A patient presents with right upper quadrant pain radiating to the shoulder, fever, and jaundice. The nurse suspects acute pancreatitis, acute cholecystitis, bowel obstruction, perforated peptic ulcer. Question 14. A patient presents with a high-pressure paint gun injury to the hand. The nurse's priority is soaking the hand in warm saline, icing and elevating the extremity, preparing the patient for surgical exploration, administering a digital block. Question 15. A patient presents with a sickle cell crisis and reports severe pain. The nurse should encourage oral fluid intake, administer a non-steroidal anti-inflammatory drug, administer opioids as ordered, apply a cold compress to the area. Question 16. A patient is brought to the ED after being struck by lightning. Which finding is most concerning? Confusion, unequal pupils, tachypnea, hypertension. Question 17. A patient presents with severe, tearing abdominal pain, a pulsatile abdominal mass, and hypotension. The nurse suspects acute pancreatitis, ruptured abdominal aortic aneurysm, bowel obstruction, appendicitis. Question 18. A patient presents with sudden onset pleuritic chest pain and shortness of breath after a long flight. The nurse's priority is to assess for myocardial infarction, pulmonary embolism, pneumothorax, asthma exacerbation. Question 19. A patient presents with a sudden onset of right-sided weakness, facial droop, and slurred speech. Last known well was 2 hours ago. The nurse anticipates emergent CT scan of the head, administration of aspirin 324 milligrams orally, continuous cardiac monitoring, all of the above. Question 20. A drowning victim is brought to the ED. The major physiological insult is hypothermia, pneumonia, hypoxia, dysrhythmia.